We're seeing more positive COVID-19 cases in President Trump's orbit as the country confirms record high numbers of infections. Housing and Urban Development Secretary Ben Carson revealed his positive diagnosis this morning after attending the White House election night party last week. A department spokesperson said Carson is in, quote, good spirits and feels fortunate to have access to effective therapeutics. White House Chief of Staff Mark Meadows tested positive last week after attending the same crowded party in the East Room. Sources confirmed to CBS News attorney David Bossie also tested positive this afternoon. He was Meadows' replacement, leading the president's post-election political and legal battles. Bossie has reportedly been working in the campaign's headquarters as well as traveling extensively. You can see him here with Republican Congresswoman Debbie Lesko, who will not be quarantining in Arizona last week. The U.S. has reported more than 100,000 infections per day for the last 5 days, totaling 585,000 new cases in all. The country has now confirmed more than 10 million total cases in the U.S. since the pandemic began. These skyrocketing numbers come with some potentially encouraging news. Early analysis shows a vaccine from drug maker Pfizer to be more than 90% effective in preventing COVID-19 when compared to a placebo. For more on what this means for the future of the U.S. coronavirus response, I'm joined by Dr. Dara Kass. She's a Yahoo News medical contributor and emergency room physician. She was also a part of Doctors for Biden, a group of health professionals and advocates that helped with his election effort. Doctor, welcome. Thank you so much for being with us. So this report from Pfizer has not been peer-reviewed, but some say it is promising. What exactly does this report mean, and what steps need to happen before it could be authorized for public use?
So actually, we already know what steps need to be happen because Pfizer laid them out before they announced these results. What we know is that interim data, so data showing a certain number of infections have happened, 9 out of 10 people that were infected the vaccine had worked to prevent infections in 9 out of 10 people. It was 90% effective. And what that really means is that it looks like when the data is analyzed, at the completion of the phase 3 trials, we will see a marked effect, more than our standard. We were looking for a 60% efficacy. Here we're seeing probably a 90% efficacy of prevention of disease for those that were vaccinated. It doesn't change the timeline. We know that we're not going to start evaluating this data probably until the end of November or December. And that's when we expect Pfizer to apply for its, either emergency use authorization or its full FDA clearance for the vaccine to go into production and actually be distributed to Americans, hopefully over the beginning and the middle of next year.
Well, cases in the U.S., as you know, are at an all-time high. The number of hospitalizations continues to grow, and we are headed into a crucial phase of the year. You have United Airlines saying that they're adding more than 1,400 domestic flights around Thanksgiving, expecting its busiest week since March. President-elect Biden has big plans to change the nation's response, but inauguration is 10 weeks away. So, Doctor, how crucial are the next few months here?
So the next few months are critically important for the lives of probably 100,000 Americans. We need to remember that the virus is an exponential spread in the majority of American states. We need to realize that masking up, socially distancing, and having a different holiday season this year is going to be critically important to preventing new infections. The vaccine doesn't help us right now. The therapeutics we have are really only effective in critically ill patients. The best defense against this virus is to not get it in the first place. So whether it's a celebration or a rally, whether it's a gathering for a family holiday or anything like that, it's really important that we stay home, we stay distanced, we mask up, and we make sure that we don't spread the virus amongst anybody in our family or our friends right now.
And Doctor, what changes do you want to see from the Biden administration once they take over, especially if things are not under control by then?
So I think we've already started to see it today. When we saw the response from Vice President Biden, President-elect Biden, in response to this vaccine data versus what we saw from President Trump, which was a responsible, transparent, and honest narrative about what it means and what we still need to be doing. I think that what we'll see from the next administration is continued honesty and transparency around the hard work that Americans need to do and the advances that we're making, whether it's in vaccinations, therapeutics, or even just getting this virus under control with public health metrics. I think that people are not realizing what they're missing in the calm, steady hands of a leader who understands how to get a population, a country, through a pandemic like this.
And in the interest of transparency, then, would you expect that there would be regular White House coronavirus briefings?
Yeah, I would expect actually White House briefings for coronavirus. I would expect briefings from all kinds of, leaders to help people understand how to live their lives. I think one of the hardest things about this pandemic is the questions regular Americans have had about what this means to them. And that communication void has led people to stop listening to the science because they don't think it's relevant to them. A vaccine or a therapeutic that only affects a small percentage of the population or is far away isn't as important as how can I get my kids to school and whether or not I can have Thanksgiving. So I think that what we'll see is regular, consistent messaging that is applicable to regular Americans about how they can live their life through the next administration and beyond.
Dr. Dara Kass, Doctor, thank you so much for your time.
Thank you.